The McLaren Bariatric Institute was created to treat the disease of morbid obesity. As a nation, morbid obesity is becoming an overwhelming health condition.
Health problems before surgery. I had high blood pressure, cholesterol was a little crazy.
The health problems that I had was I had acid reflux really bad, where it would wake me up every night, and I had a hard time sleeping through the night.
For many years, morbid obesity has been considered being overweight or being fat. It is not, in fact, that. It is a disease process. And as a disease process, it causes a tremendous burden on our patients.
I was a pretty young person. I was 32 or 33 years old when I made the decision to have bariatric surgery. And at that point, I was diabetic. I had high cholesterol, had borderline hypertension, had problems with my knees, my back, and just wanted to do things with my life that I wasn't able to do because of the extra weight that I was carrying around.
The general rule, a patient who has exceeded 100 pounds his or her ideal body weight, and this will translate into a BMI of over 35 with or without comorbid conditions. Diabetes heading the list, followed by high blood pressure, followed by sleep apnea, arthritic symptoms of the weight-bearing joints. In addition, coronary artery disease, hyperlipidemia, that's cholesterol and triglyceride problems, and this is associated with coronary artery disease. In addition, symptoms like chronic reflux and stress incontinence are associated with being overweight. The resolution of the diseases are far more important than the actual amount of weight that's lost.
Our facilities, the McLaren Bariatric Institute, is specially organized to deal not just with the surgical aspect of getting individuals safely through the surgery and successfully losing weight, resolving their comorbid conditions, but also treating the whole individuals. We spend a considerable amount of time with our patients before surgery. 6 weeks we spend with our patients before surgery, because we realize that surgery is just one component of this change, of this evolution that our patients are going to undergo. For many of our patients, morbid obesity has been a lifelong disease. And so we spend a considerable amount of time talking with them prior to surgery about how their life is going to be different, how it's going to be better. We spend time talking with them not just about how they're going to be eating differently, but also all of the other things that are going to be affected as their quality of life so significantly changes and improves.
What made me come to McLaren was I went to my doctor and I asked her about bariatric surgery, and she's the one that recommended McLaren.
We do the gold standard for weight reduction surgery in this country, that is the Roux-en-Y gastric bypass, and we also do the adjustable gastric banding. Well, we can use the band in almost any BMI range. However, the best result for the band would be in BMIs less than 50. This gastric banding procedure is minimally invasive. We do not cut any of the GI tract, that's the stomach is not cut, and we place a band at the uppermost portion of the stomach, creating a small pouch. And the longer the food which the patient will ingest remains in that pouch, the more it suppresses one's appetite. The success of this is dependent upon eating extremely slowly and not drinking fluids while eating. So if one does that, this very simple procedure is associated with tremendous weight loss. Because we see roughly 50% of one's weight reduction with the band over a period of 1.5 to 2 years. With the gastric bypass, however, one would see a resolution of 70 to 90% of one's excess weight during the same period of time.
The second surgical option that we offer is the Roux-en-Y gastric bypass. In the Roux-en-Y gastric bypass, which is done laparoscopically, we create a small gastric pouch that holds generally about 3 ounces. and we also bypass a small section of the small intestine. Nothing is removed. The Roux-en-Y gastric bypass is an inpatient procedure. It generally takes about 2 hours to perform, and it's done laparoscopically, which means through small little incisions. Generally, patients stay in the hospital for about 48 hours, and then they go home. Recovery time is anywhere between 7 and 10 days. As far as determining what type of operation is right for our patients, we work together as a team of individuals along with our patients to help to answer and guide them in their decision process about what type of surgery is most appropriate for them.
The hospital staff is great with us. They understand what you're going through. They work with you around the clock if you need it.
It was a wonderful experience. They made sure I was prepared. They didn't just, take my name and then the next day I had surgery. They made sure that I was really prepared and I knew that this was going to be a lifestyle change.
Following up with the physicians and the nurses and the staff at the Bariatric Institute was seamless. You go back basically and visit them a week after your surgery, 3 months after your surgery, and I went back for my year visit here just a little while ago, and everything is great. I'm doing fabulous.
Since this program has started, we have become a center of excellence, and we have had excellent results.
I'm thankful for being able to walk up the stairs without breathing hard. I'm thankful for being able to get in and out my van without struggle. I'm just thankful that I was able to lose this weight and I can live my life to the fullest.
I cannot tell you the individual joy and the wonderful smiles that we see on a daily basis in our office. I always joke that we go through more Kleenex in our office because of the laughing and tears that our patients have because they know what a significant change has occurred in their life. One of my favorite things is to see the long list of medications that our patients don't take anymore.
When I weighed over 300 pounds, I didn't mow my own lawn. I hired a gentleman to mow my lawn. Now, the gentleman's no longer employed with me. I mow my own lawn, plus I mow my neighbor's lawn, I mow my friend's lawn.
I've lost roughly 145 pounds, and I am right where I need to be. I feel really good. I feel healthy. People say that I look healthy, and this is where I need to be, where I need to stay.
We take a lot of photographs in our office. We take photographs when our patients first arrive, and then we take a picture of them a year later, and the change is remarkable. In the first picture, they're never smiling. In the second picture, they're full of smiles.
At times, when I see patients, I can't recognize them because they have lost so much weight. I have two incidents where I was with my wife and my family, and this strange woman came and hugged me, and my wife just stood back and wondered what's going on here. They were so happy to see me because they had lost so much weight. They looked very, very attractive, and I felt as though I did improve their life and made a change.
We're actually taking a trip to Cedar Point in a week, so I am so excited. I'm going to ride roller coasters for the first time in 15 years. I can't wait. I'm excited.